In an unprecedented move, the nurses in UK are all set to go on a strike. As many as 100,000 members of the Royal College of Nursing will walk out across England, Wales and Northern Ireland on Thursday and then on December 20. This will be the first time in its 106-year history that the RCN, the UK's biggest nursing union, will go on strike in England. And not just nursing union, unions of several other professions are to go on strike this December in UK. In this video, we break down the reasons why the nurses have decided to go on a strike, what their demands are and how it will impact the healthcare services in the coming days in the country. But before that, don't forget to like, share and subscribe to One India. The simple reason is pay parity. The nurses will join hundreds of thousands of other British workers who are striking this December, including rail staff, postal workers and ambulance drivers. At the center of this dispute is pay, which is failing to keep pace with inflation that hit a 41-year high of 11.1% in October. This series is the broadest wave of industrial unrest since the country's infamous winter of discontent in the late 1970s, when huge numbers of workers from truck drivers to grave diggers went on strike. The chaos has prompted Prime Minister Rishi Sunak to warn that tough new laws restricting strike action are on their way. Despite a pay rise of about €1,400 awarded this summer, experienced nurses are worse off by 20% in real terms due to successive below-inflation awards since 2010. They say the economic argument for paying nursing staff fairly was clear when billions of pounds were being spent on agency staff to plug workforce gaps. During last year, 25,000 nursing staff around the UK had left the Nursing and Midwifery Council register, with poor pay contributing to staff shortages across the country. This has put immense burden on the healthcare infrastructure and has evoked concerns about patient safety. The NHS has provided free treatment at the time of need since 1948, yet the number of patients on hospital waiting list has hit a new high of 7 million. The emergency and accident departments are similarly overburdened. And the main reason for all of this is the increasing cost of living. People in low-paid jobs have been hit hard by the rising cost of living. Poverty is on the rise and inflation is worsening. Nurses are among those who have been forced to use food banks and accept charity food parcels. Some NHS trusts have set up their own food banks or food voucher schemes to help staff get by. A study of around 1,000 NHS and social care workers claim that 63% of nurses and healthcare workers are choosing between food and fuel, while 14% are using food banks. More than 28% are also planning to leave the industry in search of better pay. Although the RCN has said that patient safety is paramount and that minimum staffing levels will be retained during strikes by following the life-preserving care model, which basically means that certain areas of care are exempt from staff strikes to prevent causing death or permanent disability. These include emergency services, urgent therapeutic services and urgent diagnostics and assessments. Non-urgent operations and outpatient appointments are expected to be postponed alongside sessions of chemotherapy and kidney dialysis. This means an extra burden on the already overstrained healthcare infrastructure. This might not be a good omen, especially in a situation when there is an impasse between the government and the union. Only the common people of the country will suffer. These were important information about the nurses' strike that is going to take place on Thursday and later on December 20. We hope you would like this new video. Thank you for watching.
Subscribe to One India channel and never miss an update.